everyone, and welcome to Two Healing Minds. Today we share a critical topic on clinical depression. It's more than just feeling sad. It's a complex mental health condition that affects millions worldwide. Join me as we unravel the layers of clinical depression, its symptoms, treatment options, and its impact on individuals. We know the journey can be difficult and sometimes feel unbearable, and understanding this condition and treatment options help you move forward to improve. Clinical depression, also known as major depressive disorder, MDD, is a serious mental health condition characterized by persistent feelings of sadness, hopelessness, and loss of interest or pleasure in activities. It's important to distinguish clinical depression from occasional feelings of sadness or grief, as it can significantly impair daily functioning and quality of life. Symptoms of clinical depression may vary from person to person, but often include persistent feelings of sadness, irritability, fatigue, changes in appetite or weight, difficulty concentrating, and thoughts of self-harm or suicide. Clinical depression impacts individuals from all walks of life, regardless of age, gender, or socioeconomic status. It's estimated that over 300 million people worldwide suffer from depression, making it one of the leading causes of disability globally. Various factors contribute to the development of clinical depression, including genetics, brain chemistry, life events, and underlying medical conditions. Individuals with a family history of depression, or those who have experienced significant trauma or stress, are at higher risk. How do you get diagnosed with clinical depression? Diagnosis of clinical depression typically involves a comprehensive assessment by a qualified mental health professional, such as a psychiatrist or psychologist. Here's an overview of the diagnostic process, symptoms, and duration required for diagnosis. 1. Initial evaluation. The diagnostic process often begins with an initial evaluation, where the healthcare provider gathers information about your medical history, family history of mental health conditions, and current symptoms. 2. Clinical interview. A clinical interview is conducted to assess your mood, thoughts, behaviors, and overall functioning. The healthcare provider may ask questions about the duration and severity of symptoms, triggers or stressors, and any past experiences with depression. 3. Physical examination. A physical examination may be performed to rule out any underlying medical conditions that could be contributing to the symptoms of depression. 4. Diagnostic criteria. The diagnosis of clinical depression is based on specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, published by the American Psychiatric Association. The DSM-5 criteria include the presence of specific symptoms and the duration and severity of symptoms. The symptoms of clinical depression can vary from person to person, but commonly include persistent feelings of sadness, emptiness, or hopelessness, loss of interest or pleasure in activities once enjoyed, changes in appetite or weight, insomnia or oversleeping, fatigue or lack of energy, feelings of worthlessness or excessive guilt, difficulty concentrating or making decisions, thoughts of death or suicide. To meet the diagnostic criteria for clinical depression, you must have had persistent symptoms for at least 2 weeks. These symptoms must significantly impair your ability to function in daily life, impacting areas such as work, school, relationships, or self-care. It's important to note that clinical depression can manifest differently in each individual, and not everyone experiences the same symptoms or severity. Additionally, depression can occur in episodes, with periods of remission followed by recurrent episodes. Fortunately, clinical depression is treatable, and there are several effective treatment options available. Seeking professional help is crucial for proper diagnosis and treatment planning. It is important to reach out to a psychiatrist or psychologist. Mental health care should be part of your insurance plan. If you do not have health insurance, there are discounts for cash patients, or contact your local hospital or dial the crisis line 988 for immediate care. Therapeutic interventions such as cognitive behavioral therapy, CBT, and interpersonal therapy, IPT, are often recommended to address negative thought patterns and improve coping skills. There is one option in the description below for online therapy. They also offer discounts if you require financial assistance. In addition to therapy, medication may be prescribed to help regulate neurotransmitters in the brain associated with mood regulation. Antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, or serotonin norepinephrine reuptake inhibitors, SNRIs, are commonly prescribed medications for managing symptoms of clinical depression. Typically, a combination of medication and therapy is the most effective course of action. Incorporating lifestyle modifications is an integral part of managing clinical depression and promoting overall well-being. Let's explore some specific examples. First, regular exercise has been shown to have profound effects on mood regulation and mental health. Engaging in activities such as walking, jogging, yoga, or swimming releases endorphins, also known as feel-good hormones, which can help alleviate symptoms of depression and reduce stress levels. Find something you enjoy and do not worry about the duration. Second, prioritizing adequate sleep is essential for maintaining emotional balance and cognitive function. Establishing a consistent sleep schedule, creating a relaxing bedtime routine, and minimizing exposure to screens before bedtime can improve sleep quality and promote mental well-being. Insomnia can be a huge issue, and the key is to do research on the various options to help you, and we do have one video on that. It can also be sleeping too much. Good sleep habits will be difficult at first, but work with your therapist to explore various options. Additionally, adopting healthy eating habits can positively impact mood and energy levels. Consuming a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats provides essential nutrients that support brain health and neurotransmitter function. Of course, this will be difficult because this is a time when emotional eating, overeating, or not eating enough to meet nutritional needs is common. This will also take time to create better habits. It may not be easy, but you can begin gradually to improve your health. Fourth, practicing stress management techniques can help individuals cope with the challenges of clinical depression. Mindfulness meditation, deep breathing exercises, progressive muscle relaxation, and guided imagery are effective strategies for reducing stress and promoting relaxation. Can you restart an interest or a new one even if it is for a short time? There are so many options, and you will need to work with your therapist to choose what works for you and what doesn't. Lastly, fostering social connections and engaging in meaningful activities can provide a sense of purpose and fulfillment. Spending quality time with loved ones, participating in hobbies or interests, and volunteering in the community can help individuals feel connected and supported. Even if you have a hard time finding support, it only takes one person who understands you and wants to help. This is something you can also work with your therapist to get the one-on-one attention. Clinical depression is a debilitating mental health condition that requires understanding, support, and effective treatment. I know it is hard, especially with a condition where you do not feel motivated, energetic, or positive. It is something you must work with gradually. You may also need to consider other lifestyle changes, such as where you live, your job, who is in your life, and how you care for your basic needs. It is hard to cover in a short video, but this is to get you started. I know there is more to this condition, but with persistence, understanding, and professional help, you can gradually promote recovery from severe depression. Resilience is in your hands. Even if it seems unbearable or impossible, do not give up. If you or someone you know is struggling with symptoms of depression, know that help is available. Remember, you are not alone, and there is hope for recovery and healing. Thank you for joining me today as we explored clinical depression. If you found this video helpful, please consider sharing it with others who may benefit. Together, let's continue to raise awareness and foster compassion for those affected by mental health conditions. How have you managed clinical depression symptoms? Share below in the comments. Please don't forget to subscribe to our channel. Thank you.